For the next segment of the AGM, we have three very amazing guest speakers who have joined us today. The first guest speaker that we have today is Anna Greenberg, the Chief Regional Officer of Toronto and East Ontario Health. Anna has been a highly valued member of the Ontario Health senior leadership team since the organization's beginning. She served as Chief of Strategy and Planning, leading the development of many strategic and corporate initiatives, and was instrumental in support of Ontario Health's system response to the COVID-19 pandemic. Her commitment to actively listening, engaging, and educating has helped Ontario Health better recognize and address barriers to equity. She spearheaded the development of our comprehensive equity, inclusion, and diversity and anti-racism framework and continues to provide provincial executive leadership for the important work. A former president of Health Quality Ontario, Anna championed improved performance monitoring, public reporting, and clinical standards. She was formerly Director Strategic Policy at the Ministry of Health and Long-Term Care. Before that, she spent over a decade in leadership roles in the cancer system, shaping system performance measurement, planning, and policy, as well as knowledge management at Cancer Care Ontario, Princess Margaret Hospital, University Health Network, and the Canadian Partnership Against Cancer. As Chief Regional Officer, Anna is directly responsible for the region's operational and system planning, supporting the healthcare system in implementing a pandemic response, advancing health system transformation, improving access to mental health and addiction services, and improving health equity across the region. So could we please give a round of applause for Anna Greenberg?
Thank you so much. Is this on? Oops. Now it's on. Perfect. Thank you. So thank you for that warm introduction. I'll just say that it's really an honor to be able to speak at your nearly 40 years of history in this organization at your 37th annual general meeting. And I know this organization grew up in this neighborhood and really became a star in the pandemic, maybe before that, but that's when you were on the map for me. And almost, I would say this organization was built for the crisis that we just had in this city, in this province, in terms of the model that you had already developed. And it meant that we as Ontario Health could call on you in a time of need, and you paid dividends in terms of being able to step up for the community and really stay true to your ethos in terms of being a neighborhood organization. I think you're celebrating today the community ambassador model and the community ambassadors who reflect this organization. And that's something that is now widely known. It's a famous concept. It's something that the health system will probably never turn away from now. And you had really, spearheaded that, and the thought that you put into that model has been an inspiration for policy in this province. On behalf of Ontario Health and Ontario Health Toronto, I'm really proud to say that we are a strong and solid partner of the neighborhood organization. I get to stand here, but I know that, and I'm new to being a partner with the neighborhood organization, but the relationship that Ontario Health has and formerly the Toronto Central LHIN had with the neighborhood organization was 12 years in the making. And it really was a deep and trusting relationship and a history that built the Thorncliffe Park Hub, the Health Access St. Jamestown, all facilitated with partnership with the United Way. And now your involvement in two Ontario Health teams has really advanced that model and is an inspiration to that model. And I think it's the strength of that neighborhood model that I think a lot of people believe they know, but when you're here and you see this organization and you understand truly what that means and the history that you've brought to that, there's a fidelity to that model that we'd love to see, exported to other places, but really expanded with this organization. So as Ontario Health and formerly the Toronto Central LHIN, I'm now part of a much bigger organization than you were first partnering with when we were the Toronto Central LHIN. But I can tell you that the Toronto region is very much alive and well, and your partnership, your organization is a prime example of the type of what we call hyper-local work that we know none of what we want to do provincially, none of the standards that we want to set, none of the policies that we want to see reach people in Ontario can happen without local implementation. It has to make sense for communities. It has to make sense for the organizations that work with those communities. And we know that that is the heart of what you do and for the neighborhoods and communities in Toronto. And that what I think what matters most is where our work can have an impact on communities and people and neighborhoods. And I would say for that reason, although it may be a larger organization, this will very much be true to what we advance. We don't intend to become a different kind of partner to you. We know that what has worked before is that local trusting relationship. So I do just want to highlight a few ways in which you brought this neighborhood model to life in what has been a deep crisis in our health system, in our society, in our economy. And obviously the neighborhood organization, you can see on the posters around the room, played a key role in COVID testing and vaccination, meaning how could you bring this to communities in a way that would be acceptable, that was accessible, and that could reach the needs of newcomers in particular. And this was absolutely vital at a time when, for many good reasons, people were hesitant to trust these vaccines. And I think through your good work, you bridged the trust that was needed between what Queen's Park might say we want to do and we want to do rapidly, and what this would mean for families and people in the communities that you serve. You were successful in your longstanding model of using community ambassadors as core members of the healthcare team. And this is, as I said, something that we now see as essential for moving forward in our health system recovery efforts. Community ambassadors, I would say, are the human touch that's needed for any of our healthcare goals. And the care that you take in selecting community ambassadors reflects that. They are of the community. They grew up in the community. They think about the different language needs, the many different language needs in different communities in Toronto. You think about how active and engaged a person is. Are they visible to the community? Will people trust them and listen to them? And that is a reflection of the people that you're celebrating tonight. Can they bridge any gaps with healthcare professionals who may not have that access to understanding what the barriers are and between access to healthcare and the needs of the community? And can they be nimble and think about those barriers and creative ways to remove them is the most important part, I think, and supporting an ethos that's truly door to door and unit by unit. So things like truly customized supports for people in the community. I've heard the stories of, providing babysitting in a pinch when someone needed to go get a test or their shot, or taking the time to listen and speak repeatedly and, importantly, patiently to a community member who wasn't sure about the vaccine for their family, and the repeated conversations that led to that whole family receiving a life-saving vaccine. And this is all in support of the goal of health promotion. And I think it's truly understanding those barriers, having empathy for those barriers, and taking the time to remove them in a way that's going to further build that trust that makes your model so successful. And I also just mentioned one of the other things that I think makes this organization so successful, and that's its ability to partner. And you work closely with larger organizations. That can be Michael Garron Hospital, that can be the University Health Network, but you don't lose that front-facing relationship with the community in so doing. And that's about a two-sided, very trusting relationship, and the ability for those organizations to rely on you for delivering on what it is that your vision provides to this community. My team members and I just had the opportunity to do a tour. It was an exceptional and really pleasurable afternoon to see this hub, to understand the history of this organization, to go over to Taylor Massey and see what the vision for the future is. And I think so much of that afternoon underscored for me the way in which you are really a people organization. The people that are part of your organization reflects your vision and your ethos. Each person is here because it's a calling. At least that's what it feels like. There's a love for the community that comes through in the work that you do that can't be replicated and without that true passion being at the core of it, and that deep understanding of the community and the unique barriers that the community may face in when we're thinking about some of the goals for population health, for primary care, for social services, and you bring it together in the hub model and the neighborhood model that you've designed. So I've been in this role for almost a year now, and Ahmed was one of the first people my team urged me to meet to understand what this role really meant in terms of this hyper-local focus. And this is a partnership that I feel incredibly lucky to be inheriting. And I know that my team members who couldn't be here today, Raj Krishna Pillai, Wilfred Chung, and Madeline Morgenstern, all point to TNO as a shining example of the types of partners we need for the tough health system recovery that we have ahead. And I just want to say thank you for your commitment and for your service to the people of Toronto. Thank you.